A very good morning and welcome to the session on the topic Preventing Cancer in Women. We are glad to have Dr. Sheetal Agarwal among us today, the senior consultant in Apollo Cradles and Children Hospital Nehru Enclave. She'll help us understand the topic and all the important details related to the topic today. So be there till the last of the session. Also, if you have any doubts, any queries related to the topic or related to particular, gynec issues or any issues of that sorts, you can post that on the comment section so that a doctor can take it once she's done with the session. So stay tuned till the last. And now, doctor, you have the stage.
Hi, good morning. This is Dr. Sheetal Agarwal, and I'm a senior consultant obstetrician practicing at Apollo Cradle daily, Nehru Enclave. So today I'm going to take something very important, how to prevent cancers in the woman. Now, a cancer, the word cancer only, it really scares us. Ki cancer ho gaya, kya ho gaya? So here I would like to tell you that there are certain means and methods by which we can prevent cancer and we can diagnose it early so that we can take proper adequate measures when it strikes us. So what exactly is cancer? Next slide, please. So what exactly is cancer? Cancer means when the cells in the body, they start multiplying at an abnormal rate. They start multiplying, then that organ of a body, it starts becoming cancerous. And once these cells, they migrate to other parts of the body, the cancer becomes malignant. So this is basic etiology of cancer कि एक organ के cells बहुत ज़्यादा multiply करते हैं and then they start migrating to other parts of the body. This abnormal high rate of division of the cells, they migrate to other parts of the body and then it becomes malignant. So screening and preventing cancer in the early stage can generally reduce the complications and the fatality rate of cancer. So in this webinar, I'm going to discuss 4 common cancers which are seen in the woman. So they are first and foremost is cancer breast, then cancer cervix, then uterine cancer, and in the last, I will tell you in brief about the ovarian cancer. So I'll just take in brief each and every cancer. Coming to cancer breast. Cancer breast is the most common cause of cancer which is seen in the females worldwide. So it is a cancer in the breast tissue of the woman. And the most common, as I've told you, it is the most common form of cancer which is seen in India and even worldwide. Most likely it is caused by the genetic changes. So who is at the high risk for cancer breast? Normally a woman who has never had a child before, she is at a very high risk of having cancer breast. Of course, if you have a child and you are not breastfeeding the child, again that puts you in a high risk category. So it is very important to have children, and if have children, it is very important to breastfeed the child. There are 2 advantages of breastfeeding the child. One, it prevents the cancer breast. Second, it puts the mother back in the shape. So mind you, ladies, all those who are listening, if you forever, whenever you deliver, please see to it that you breastfeed the child. And this breastfeed is also very nutritious for the child also. What are the other predisposing factors, high risk factors? When you are using birth control pills for a very long time, say a lady is having oral contraceptive pills, say she is using it continuously for 5 years, 10 years, she is at a very high risk of having cancer breast. Family history is again a very important reason. So, if in your family there is cancer breast, especially in your grandmother, maternal grandmother, in your masis, in your mother, it is you have to really take all the precautions and you have to regularly get yourself screened because maybe you have a gene that is predisposes you to cancer breast. So family history and genetic predisposition is very important in cancer breast. Certain cancer genes which are inherited like BRCA1 and BRCA2, BRCA1 and BRCA2, they are, they can really cause malignant changes in the breast. I remember a few years back, there was a large hue and cry that Angelina Jolie has got her breast removed, she has got her ovaries removed. I would like to tell you that Angelina Jolie's mother and maternal grandmother both had cancer breast. And when her screening was done, she was BRCA1 positive and BRCA2 positive, meaning she was highly predisposed to cancer breast. So, as a precautionary measure, she got her mastectomy done. That is, she got her breast removed, she got her ovaries removed also. So, of course, I'm not saying that we should take such a drastic step, but this should be at the back of your mind that if there is a very strong family history, in that case, you must get your BRCA1 and BRCA2 test done. Another important predisposing factor is when you are overweight. So when you're obese, your BMI is more than 35, your breast is very enlarged, again it predisposes you to having cancer breast. Another very important this predisposing factor is when you have early menarche. By early menarche I mean your periods start at 8 to 9 years of age, or when you enter menopause late, you are having your periods till 55, 56 years of age. That again predisposes you to see a breast. And of course, drinking alcohol, lifestyle changes are also a high risk factor for cancer breast. So, what are the early signs of cancer breast? There are no signs and symptoms. Remember, ladies, that these malignancies generally they are asymptomatic. So, what you will notice is you will notice that maybe there is a lump in the breast while doing your general routine examination, or just like that, you will notice a lump in the breast. You may notice a small thickening or swelling, at a localized area of the breast. The nipples may be retracted. If you press on the nipple, there may be greenish discharge. There can be redness or flaky skin. We typically call it PUD orange. If you see the orange, you will find multiple pitted skin. That skin, if you see on the breast, it should ring the alarm bells that this PUD orange skin type of skin could be over any breast malignancy. There could be pain, there could not be pain. As I've told you, mostly they are asymptomatic. And if you examine, there could be slight change in the shape and size of the breast. So, how do you go about it? Breast self-examination is very important. So, once a month, all of us, all the females, while taking a bath, they should self-examine their breast. Normally, it is done in the standing position in front of the mirror. You just put your hands either above your head or at your waist, and you see the normal shape of the breast. You see whether there is any, redness is there, or whether there is any sagging of the one breast or not. Another thing is that then you do the palpation of the breast after doing the visual inspection. While standing, you do the palpation. So the breast whose palpation you are doing, that arm should be at the your side of the head, and with the opposite hand using the palm, you should palpate your all whole of the breast, all the four quadrants of the breast. Similarly, you do with the opposite side. The same arm should be at behind the head, and with the opposite hand, using the palm, you should do your palpation. So whenever what you will see, whenever you will find that there is any lump without any defined margins, no defined irregular lump, or a mass which is hard, firm, irregular, not having any margins, ill-defined margins, or you see the retracted nipple, or when you press on the nipple there is greenish discharge. Mind you, girls, these are the changes that you immediately have to consult your gynec or an onco surgeon and get yourself examined, get yourself tested for CA breast. So self-examination of breast should be a part of routine for all the females, irrespective of their age. I should say that now I'm seeing breast cancer as early as 22, 23 years of age. So I feel that all the young girls after 20 should go ahead, do their self-examination of the breast while taking a bath, standing and in the lying down position, the way I have told you. Then how to prevent breast cancer? Again, you have to get yourself screened, especially if you have a strong family history. Mammography should be done after the age of 40, but before that, we have very high resolution ultrasounds available these days with 5D scans, which can, which in some cases are better than mammography in depicting any mass or any lump in the breast. Please control your weight, have your exercise regime. I normally recommend 30 minutes in a day for 5 days a week. All of us should have, should do some exercise keep your weight in control, especially in the postmenopausal age when the BMR, our basal metabolic rate, slows down. The ladies tend to get to gain weight, especially on the breast, on the abdomen. So if you have follow this regime of 30 minutes every day for 5 days a week, your weight will be definitely in control. Know your family history, very important. If there is any if you find out how your grandmother, your masis or your mother, what was the cause of their death, to know your family history will definitely give you an edge when you know that what is happening in your family, and you will be aware of the things. Avoid unnecessary medical radiation like x-rays. If it is necessary, go for it, but don't unnecessarily go for any radiation exposure. Many a times women who are at high risk, they take medicines like tamoxifen, etc., to prevent cancer breast, but please, you take it under the guidance of a gynecologist. Don't take it on your own. Limit your amount of alcohol. Not necessarily that you have to daily take 100 ml, 120 ml. Please limit your alcohol intake. Next, I'm going to talk about cervical cancer. The second most common cancer of ladies in India is cancer cervix. What is cancer cervix? It is a cancer of the lower part of the uterus. So uterus ka lower part, the mouth of the uterus, is called cervix. The cancer of that is cervical cancer. It is not the cancer of the nape of the neck. It is the cancer of the mouth of the uterus, which we call cervical cancer. And here I would like to tell you that the causative cause of cervical cancer is known. In 90% of the cases, it is caused by a virus which is known as human papilloma virus. So who are at the high risk of cancer cervix? Again, your lifestyle. If you're a chronic smoker, you're a chronic alcoholic, you have a very high risk of cancer cervix. Another important factor is that if you have your sexual debut at a very young age and you have multiple sexual partners, that means you start your sexual activity, say by the time you are 13, 14 or 12 years of age, and by the time you reach 20, you have multiple sexual partners, you are at a very high risk of cancer cervix. Your first pregnancy is a very early pregnancy, again, that predisposes you to cancer cervix. Or there is a family history. So family history is very important in malignancies. If you have a family history of cancer cervix, again, you are at a high risk of cervical cancer. Women with sexual, I have already told you, yes, very important is if you take, again, birth control pills, OCPs, if taken for a long time. So it not only predisposes you to cancer breast, it also predisposes you to cervical cancer. So what are the early signs of cancer cervix? Most common sign is that your periods have stopped and then again you start bleeding. That means in between bleeding, you bleed for a longer time. Normally, if your cycle lasts for 5 to 6 days, you are bleeding for 8 to 10 days every month. And then again, once the bleeding stops after 3, 4 days, you stop bleeding. So that is a very, that should hit something in your mind that maybe something is wrong with me. There is bleeding after every sexual activity. So once you have a bleeding after every sexual activity, again, please don't sit at home. Don't neglect it. It is very common that there could be some malignancy of the cervical cancer, or there could be just benign polyp. But again, you have to go to the doctor and show. Postmenopausal bleeding can also be seen in cervical cancer. Another important sign is when you have a discharge, very foul smelling discharge. It is such a discharge, the moment patient enters the OPD, we can make out this female is suffering from cancer. It hits us like anything. So when a very foul smelling discharge, it is, like she has to change pads for the discharge. It is a very, it is most commonly seen in cancer cervix, late stages of cancer cervix. Then how to prevent cancer cervix? As I have told you, we know the causative cause of cancer cervix, which is human papilloma virus. So there are vaccines available for it. I'll talk to you in a few minutes what exactly vaccines are there. Before that, I would like to tell you that practice safe sex. Use condoms whenever you're having multiple sexual partners. Routine screening is very important. By routine screening, I mean that you have to get your pap smear done. This pap smear will tell us whether everything is fine, you are in dysplasia or CIN 1, 2, 3, or you are in a precancerous state. So pap screening is very important, and I will tell you how frequently you should go for pap screening. And of course, avoid smoking and alcohol. So, about coming to human papilloma virus vaccine, I would like to tell you that there are two types of vaccine available. Bivalent, which is Cervarix, goes by the name of Cervarix, and quadrivalent, which goes by the name of Gardasil. The Indian Association of Pediatricians, they are trying to put this cervical cancer in our national immunization schedule. So once this vaccine is introduced, I'm sure it is going to help a lot of young girls. Normally, this vaccine should be given before the girl becomes sexually active. So we are giving it as early as 9 to 10 years of age. Initially, it was said that it should be given till 26 years of age, but we recommend that it should be given till 45 years of age. So it is a course of 3 vaccines given over a period of 6 months. 0, 1, and 6 is the schedule for Cervarix vaccine, and 0, 2, and 6 is the schedule for Gardasil vaccine. They are extremely effective in preventing cervical cancer, especially if they are given before the onset of the sexual activity. Coming to pap smear, how frequently you should do pap smear? Normally, if a lady has been sexually active for 3 years, she should get her pap smear done. That means if you become sexually active at 15 years of age, then mind you, your pap smear should be done started from 18 years of age. So it all depends upon when you become sexually active. 3 years after that, get your pap smear done every 3 years till 39, 40 years of age, 30 years of age, and thereafter combine this pap smear with HPV DNA test, and it should be done every 5 years if it is negative. But if we find something suspicious, it should be repeated every week. So the latest guideline is that we should not do it every year. It should be done, if everything is okay, every 3 years till 30 years of age. Thereafter, combine PAPs with HPV DNA every 5 years till everything is okay till 65 years of age. In case of any suspicion, we may have to repeat it even in 6 months' time, otherwise yearly in case of any suspicion. Coming to the next cancer, which is uterine cancer, that means the cancer of the body of the uterus. अभी से पहले I was telling you the cancer of the mouth of the uterus, cervical cancer, now cancer of the body of the uterus, womb. It is also called endometrial cancer, and it is usually due to lifestyle factors, So who are at the high risk? Old age, normally, in the postmenopausal age, it is very commonly seen. Again, it is seen when you have very early menarche, that means your menstruation starts very early at the age of 9 or 10 years of age, or your menopause comes very late, say by, after 55 years of age, or when you have not become pregnant at all, or you are undergoing hormone therapy. See, there are many ladies, once their periods stop, they come to us, give us HRT, hormone replacement therapy, I'm having hot flashes. Normally, we try to treat them without starting them on HRT. It is only when the lady is having severe symptoms that we start her on HRT. And if she continues HRT for a very prolonged period of time, this predisposes her to cancer uterus, endometrial cancer. So we have to really limit it. We don't have to give it for an exponentially long period of time. Any previous history of breast or ovarian cancer can also predispose to endometrial cancer. Other diseases like diabetes, I told you it is due to lifestyle changes. So if you have diabetes, you have hypertension, you have obesity, you have PCOD, you are highly predisposed to cancer and endometrium. It is, like while we were studying, it was a case of fat fertile female more than 40. 4F we used to remember for a case of CA endometrium, fat, you are obese, fertile, you have many children, more than 40, fat fertile female more than 40, having diabetes and hypertension. She is highly predisposed to cancer, endometrium or uterine cancer. So what are the early signs of uterine cancer? Mostly they are asymptomatic, I've told you, but they can have very heavy bleeding, prolonged bleeding. She continues to bleed for, 20, 30 days, or the bleeding doesn't stop, or she has postmenopausal bleeding, or there could be pain in the pelvis. All these are the early signs of cancer cervix. How to prevent uterine cancer? Again, I've told you, if a lady is on hormone replacement therapy, restricted. Don't give it for, for a long period of time. Whenever there is any abnormal bleeding, please go to your gynecologist. Consult her, get the test done, get ultrasound done. take an expert opinion. Just don't sit at home listening to the older ladies. अरे periods खत्म होने वाले हैं, ये तो होता ही रहता है. No, any abnormal bleeding can cause, it has to be taken very seriously. If you are obese, you are diabetic, you are hypertension, get yourself checked regularly. Try to, control your diabetes, try to control your hypertension and manage your weight by the exercises, which I have told you should be done 30 minutes a day for 5 days in a week. Then coming to the ovarian cancer. Ovarian cancer is the cancer which is seen in the ovaries. Normally, it is the, again, very common cancer of the ladies, and it has been rising in the past 2 decades. Initially, while I was studying, we used to see ovarian cancer in the ladies over 50 years of age. But now, in my practice, I'm seeing it in as young as 21, 22 years of girls. Recently, last week, I have operated on a female. She was 22 years of age. She had a big ovarian mass. And once we did the surgery, we just removed the mass and sent for frozen. It turned out to be well differentiated mucinous adenocarcinoma. And we had to remove her uterus, contralateral ovary, do the radical hysterectomy, remove the lymph nodes, or lumpectomy. So what I mean to say is that the cases of ovarian cancer are rising even in the young unmarried girls also. So who is at the high risk of ovarian cancer? Again, if there's a family history in your family, there is no pregnancy, or you have a late pregnancy, first pregnancy after 35, 36 years of age, late menopause, you are on a hormone therapy. And normally, when you are old, after 55, 56 years of age, the chances of malignant ovarian increases. What are the early signs of ovarian cancer? You will feel that your the abdomen girth is increasing. Generally, I see the lay patients who come to me कि मोटापा बढ़ रहा है, and when you put the hand on the abdomen, there's a big mass. So there is maybe a feeling of mass or a lump in the abdomen. And if a lady is not very aware, she'll just come and tell you, यार मोटापा बढ़ रहा है, पेट में चर्बी बढ़ती जा रही है, पेट बढ़ता जा रहा है. You can also have postmenopausal bleeding or abnormal bleeding. In the late stages, we generally see the ladies are very emaciated, cacaxic in the late stages of ovarian cancer. There is generalized weakness of the body, and they can have pressure symptoms also with such a big mass in the abdomen. They can have constipation, they can have urinary bladder irritation. So these pressure symptoms are also there. Then how to prevent ovarian cancer? Avoid hormone therapy, please. If your postmenopausal symptoms can be controlled by non-hormonal therapy, try to avoid hormonal therapy. Maintain a healthy weight. Closely observe your body. Ladies, we know our body more than anyone else. So anything abnormal that you notice in your body, in the form of discharge from the nipple, in the form of abnormal uterine bleeding, in the form of bleeding after the sex, don't take it lightly. Don't listen कि ये तो bleeding तो होती रहती है, अब महीना खत्म होने वाला है तो ये bleeding तो आपकी होती रहेगी. No. Anything abnormal you notice in your body, since you are the person who knows your body very well, immediately take a gynae consultation. Get yourself examined, get your pap smear done, get your ultrasound done, get your mammography done if required, and try to find out the cause of these abnormal things in your body. So what is the take-home message? The take-home message is eat a healthy, balanced diet. Do your exercises every 30 minutes. Have an active lifestyle. Every 30 minutes a day for 5 days a week. Do your exercises. Do practice de-stressing and mindfulness regularly. Observe signs. Whenever you observe any symptoms and signs in your body, take them seriously. Don't neglect them. And be aware about the risks and get yourself screened regularly. Thank you. Any questions? Any questions? So I think I made myself very clear. So all the best. My best luck to, best wishes to everyone. Happy New Year to everyone. And please take care, all of you. Thank you. Namaste.